in the industrial action is a creation, okay, of an insensitive leadership. When you have a government that does not do what is appropriate to nip such in the bud, then you get to that point. For example, you want to look at who are doctors. You know, you see doctors are, they are people that practice a noble profession. Historically, we have professors. I'm talking to you. I know professors about 80 years old in Lagos, all over the country, are still practicing medicine. You want to agree with me that this group of people, young, old, intermediate layer, are responsible people? This industrial disharmony, industrial action, they are a product, okay, of a government that has refused over time to actually, look into issues that are being raised by various unions, not even doctors alone, all right? And when you have situations where legislation are done on the basis of inducement, all right, rather than based on the basis of merits, then you have laws and policies that are capable of creating chaos, like the one you have in the health sector. Let me just extract some of the current challenge going on in the health sector. You have the doctors in the hospital, you have the health institution, okay? Primarily, you have the doctor. If you are going to the hospital, who do you go to see? When you want to leave your house, who do you say, I want to go and see my doctor? Historically, over the years in history, 500 years down the line, this profession developed what we call the allied, health professionals, laboratory scientists, pharmacists. Okay, traditionally, the doctor was the all-in-all. The initial, in the early periods, when the doctor does it, he mixes his medication. But now you have all the allied. You now have a situation where we're having something in Nigeria that is not known to man. For example, allied health workers want to start heading the hospital. And what is the explanation? Oh, it's teamwork. Then we keep on asking them, since it's teamwork, will you allow the air hostess to fly the plane? Who is the vice chancellor of the university? I'm sure it's perhaps one of the most senior or professor in the university. You won't say, oh, because somebody is giving us light and he's the head of the maintenance, he wants to become the vice chancellor. All right? Then one of the contentions again is that, because the way we see some of these things actually is a conspiracy against the Nigerian people. Okay, by some of these allied health workers and some people in government, because they are straightforward things. Who is a consultant? A consultant represents the highest echelon of the medical profession. Somebody who after the initial minimum of 6 years in medical school have gone further again to spend another like minimum of 6 years. And it is these consultants that own patients. There are some languages that are used in relation to professions. Okay, they are not confusing. A consultant owns the patient. It takes responsibility. You now look at a situation whereby nurses want to also be called consultants. And government is about granting that. Lab scientists want to say, this is going to create what you call anarchy. It is very simple. Who reserves the right for the chain of command is the consultant. Is the one that takes decision on the management of the patient. Is the one that will say this patient requires also drug before the pharmacist will go and say, okay, we have this drug in the pharmacy we're giving. All right, is it not the truth? It is the doctor who will do surgery and say, I want this wound to be dressed every other day before the nurse will go and dress that wound. So everybody is now a consultant who takes order. You are going to disrupt what you call the chain of command, and the only thing that will be created is anarchy and chaos. In the hospital setting, you have the pharmacy department, you have the nursing department, you have the medical records. People of those professions head those departments. We must set the records clear. Nigerian doctors are now clamoring because a lot of the detractors are trying to blackmail their doctors and strike because of money. No. We have like 24 points in mind. I'm just taking about 2 of it. One of the main things that we're asking is that the Nigerian legislature cannot say that the National Health Insurance Scheme should target only 30% of Nigerians. What happens to the rest? We are saying that there must be affordable and accessible health coverage for all Nigerians. After all, we are not asking. We know people in government go to Germany, they go to America to access health. I want to challenge people in government to actually show us their own cards. They should come and be attending the public hospitals. All right? So we don't even want to go there, but the ones that let it be the one we can access. We talk about hazard allowance for doctors. You know, doctors, doctor, are talking of 5,000 naira hazard allowance for a doctor. Now we're talking of Ebola outbreak. Those are disease conditions that are about 90% or more fatal. The HIV virus, hepatitis. Treatment of hepatitis alone, pregnant interferon will cost about 120,000 injection for 1 month. If a doctor contacts that, what happens to that doctor? You know, there are a lot of things we have to look into. And I just think that the debacle that is currently on ground is brought upon the Nigerian people, not by the doctors.
And that's exactly why we are also curious. Is there any other way doctors can address issues rather than go on strike? Because we do not even see it as if the strike is affecting the government that is supposed to be on its toes to address this. Do you think this strike is attracting the appropriate attention?
Well, negotiations have been going on. Some of these demands, the Nigerian Medical Association at the national level with the negotiating team, we're talking to government. But as at the last time, whatever was put forward is not acceptable. You see, what has brought the doctors to this point is taking the interest of the generality. All right? No, we can't just do this. The system must. And the political leaders, they take advantage of that. But it's better once and for all to resolve this so that we will not have any reason. When last did the Nigerian Medical Association go on strike? I want you to go down maybe 17, 20 years ago. That is the reality. So you should know, and these issues have been there. What you are having presently is a combination of, years and years of an insensitive system. That is, when the government is not sensitive to, what people are advancing, it will definitely get to a point of chaos. That is like what you are having now.
So, but people are now very curious that they even allege that some of you doctors have your own private specialist hospitals, and that's why you don't bother whether the public hospitals are shut down. It doesn't affect you, it doesn't affect the government, but that the masses are the ones suffering it.
Then I want to put the question back to you. So, these private hospitals, are they a new creation? No, you see, that's when there are some blackmail and detractions that you don't need to really, join issues with. There is a strike because, so doctors will create strike because they are private hospitals. So over these 100 years of medical practice, there have been no private hospitals. These are things that should not really, they are not in tandem with common sense. It doesn't.
But let's look at the reported outbreak of Ebola virus now. What are the doctors doing to help assuage the effects now that the public hospitals are shut down?
Well, when you have natural disasters, it's just natural. And because of the fact that doctors are about the most sensitive in all of these issues, when you have epidemic level of natural disasters, we move into this. And you understand, there is a reported case of Ebola confirmed. The individual had passed on. For now, at least the Lagos State government, the NMA, they are doing a lot of enlightenment. Because for Ebola, you're looking more of prevention. When things get to levels where we should respond, we do respond. In Kano, there was a bomb blast. In Kaduna, there was a bomb blast. And Nigerian Medical Association, those state branches designated hospitals where these people are looked after. You understand? So if it comes to that point that something has to be done, definitely, of course. But the key thing to be done now is public enlightenment The Nigerian Medical Association Lagos State already we have a committee, you know, that is starting to respond in the coming period of enlightening people in the marketplace and all that. You start to see some of this shortly. So we don't pray that it will get to any epidemic level. I think for now, you know, the Lagos State government have done a lot in trying to enlighten the people. You know, they've addressed press conference. Tips have gone out on, you know, how to prevent, because of course, you know, Ebola belongs to a group of viruses called the hemorrhagic virus, like the arena virus, yellow fever virus, a lot of them like that.
But
okay,
there's something that maybe you will help us confirm that bitter kola is a cure.
Well, there's what you call evidence-based. What we talk about is evidence-based medicine, and as far as we know, I mean, that is not correct on current evidence.
That is, bitter kola cannot cure.
You understand what I'm saying? On current evidence, medicine is practiced on is evidence-based. All right. So there's no such evidence as of now. Otherwise, we will have recommended bitter kola for everybody that, even as a prophylaxis, talk less of maybe treatment.
Tope Ojo.